February is American Heart Month. Joining us live to talk about a new way to help prevent stroke in certain patients is Dr. Robert Fang, a cardiac electrophysiologist with Albany Associates in Cardiology. Good afternoon, Doctor.
Good afternoon, Courtney.
We are talking today about the Watchman device. What is it and how does it help prevent stroke?
Well, before I discuss the actual implant and procedure, I wanted to describe atrial fibrillation and the risk of stroke. Patients with atrial fibrillation have a 4 to 5-fold increased risk of stroke compared to those without atrial fibrillation. It's also the most common arrhythmia, affecting 3 to 6 million Americans, and the risk increases with advancing age. So it's obviously a big health risk concern. Atrial fibrillation is an irregular beating of the heart that causes small clots to form in the left atrium, and specifically in the left atrial appendage, a small sac-like area that's part of the left atrium. Blood thinner treatment is the mainstay of preventing those clots from forming. However, the obvious side effect of blood thinners is bleeding. Many patients who take blood thinners have experienced bleeding, sometimes life-threatening bleeding. And some people also have occupations or lifestyles that can make taking blood thinners very risky. So the Watchman device is an alternate method to prevent stroke in those patients. Here's a model of the Watchman device. It's a tiny device about the size of a quarter around, and it would be used to be placed inside the sac-like opening of the left atrial appendage. And that area of the heart is where the clots form in atrial fibrillation. Over 90% of clots form in that location. So if we're able to place this device in that small area, thereby blocking the clot formation, that can be a way to reduce stroke without the need for long-term blood thinners.
Who is a candidate for this procedure?
It's a good question. So the first thing is atrial fibrillation that's not caused by a heart valve condition. Second, patients who are at increased risk of stroke, I would say moderate or intermediate to high risk for stroke. And then also people who are at increased risk for bleeding. Again, some people who have already experienced bleeding or are at increased risk for bleeding. Finally, once the implant is placed, we do need a period of time to be on the blood thinner. So you should be able to tolerate a blood thinner for a short period of time after the procedure.
What can a patient expect after that procedure is done? What about hospital stay length?
Sure. The procedure is done as an outpatient, however, you stay one night. It's done under general anesthesia, and we access the heart by a large vein in the right groin. We carefully thread that catheter, which is a plastic tube-like device that delivers the device into the left atrium. It's also very carefully positioned by echocardiography, which is ultrasound imaging, and so that we can position it, size it appropriately, etc. The stay overnight is just for bed rest mainly, and also the next day when the patient leaves, they experience minimal pain at the groin site, and they have a 1-week recovery period where they walk slowly, do not lift any heavy objects, so it's a very short recovery.
Great. And for many patients, not being on a blood thinner can be life-changing. Why is that?
So the fear of taking a blood thinner is a very, very important thing that most patients will describe. They will have theoretic risks, like a car accident, for instance, but many patients actually return to us with an experience that was bad. It could be very bad bruising, it could be prolonged bleeding from a cut, it could be trauma or an injury that led to internal bleeding, and some people even hospitalization where they're transfused, such as a gastrointestinal bleed. So these can be very scary, life-threatening events. Having this type of device is another option. If that gives the patient a chance to be off the blood thinner long-term, that takes away that fear of the blood thinner treatment. It's important to know that with this device implant, because the area has to heal over in the heart, we do need 45 days minimum of the blood thinner treatment after implant, 6 months of treatment with aspirin and Plavix, and then after that, aspirin alone. So there is a window of hope there that they could get through that early period of blood thinner treatment after the implant and then just aspirin alone, thereby being at a lower risk of bleeding long term.
Sounds like this device really can be life-changing for certain patients.
And patients are very relieved after they've gotten the device, getting off the blood thinner treatments long term.
Great. Dr. Robert Fang, thank you so much for taking time to talk with us today about the Watchman. We appreciate it.
Thank you.